Everybody joins on. I'm just going to go ahead and get started with everything. So welcome to the Early Echo CPD session. Just so you all are aware, we are recording this Echo session and it will be uploaded on our Canvas site. By participating in the session, you are consenting to being recorded. If you don't want to be recorded, you can choose to leave right now. And we also just want to let you know that ECHO is an interactive community. So we do encourage you to turn on your camera. It makes it easier for the presenters, as well as when we're doing our case narratives. It is a way to build that community of practice. If you are interested in sharing a case, please reach out to Early Echo and send that in to us. We'd love to hear from you. When you are talking in our sessions or sending in any cases, please avoid using any protective individual information. So not their real names, any identifying information about the family or ways that people would know what's going on. If you have any questions, please reach out to one of our hub members and we'll be glad to answer any of those. So we would like you to rename your profile. We're asking if you would rename it with your name, your state, your profession, as well as the company that you work for. There should be 3 dots in the top left-hand corner you will be able to rename it. There is steps on how to raise your hand. So if you go to the bottom of the Zoom, select participants, and then you can click raise hand at that. Any type of pre-registration, please reach out to earlyecho@usu.edu. We will be doing these Echo sessions the first Wednesday of every month at noon. To get a certification of attendance, we would like you will need to fill out the evaluation surveys, and those will be coming from a place called RedCap. Kurt just mentioned that he has sent those out for our demographics, and then you'll be getting one immediately after the session today. We also have a Canvas platform where we use store all of the slides as well as the recordings. And everybody should have gotten an invite to that. If you have not, please reach out to Kurt Phillips or Early Echo as well. We have a variety of ways to continue to reach out to participants by using the discussion board. If you have any further questions about that. Once again, just the case studies are just a way to share information about real life situations, hear from colleagues who can provide recommendations and receive valuable feedback. So we encourage you to reach out if you have a case that you want to share. Kate Bennington is one of our hub members, and she will be reaching out to all of us to recruit for cases. RedCap is our data collection. So sometimes you get surveys from them, and double check your junk email if you have not found those. I'm going to introduce our case presenter, but we also have a Facebook page if you want to follow us at Early Echo on Facebook. So just pull up her slides very quickly. I'm just thrilled and excited to introduce Stephanie today. Stephanie she'll tell us a little bit more about herself, but she is the director of the Utah School for the Deaf and Blind, and just brings a wealth of information. So Stephanie, I'm going to go ahead and turn the time over to you. You'll have about 35 minutes. And Take it away, Stephanie.
Okay. Can you go to the next slide?
Yes.
So it was a great introduction. My name is Stephanie Morgan. I am the director of the Parent-Infant Program for the Deaf and Hard of Hearing, which is under Utah Schools for the Deaf and Blind. My bachelor's was in special education with the emphasis in deaf education. Master's is in educational leadership and policy. And then I have the Baby Watch Early Intervention Specialist Certificate and the Utah Educator Professional License. Next slide, please. And I already shared that with the director. These are the learning objectives, and I realized I need to pin the interpreter so I will not be able to see people raise their hand. So I do not mind if you need to call out to get my attention. I don't mind that at all. So our learning objectives for today to identify how language is used in everyday life, understand how language deprivation occurs in deaf and hard of hearing children, understand how deaf, hard of hearing children access language, and identify best practice in early intervention for deaf and hard of hearing children. Next slide. So first, I want you to think about when I say the word language, what do you think that means? A lot of people immediately think vocabulary. Language does include vocabulary. However, language is a lot richer than just vocabulary. Look at the visual in the bottom right, it shows the brain, and it shows all these different things that you use with language, such as presenting, thinking, analyzing. All of this requires language. And then you think about how you use language throughout your day. It can be used to express feelings, make plans and weigh outcomes, create solutions, share experiences. I love the visual that says language is brain food. This is 100% true. Language opens the door to cognitive, academic, and social emotional intelligence. Next slide, please. So if you recall, the title of my presentation is Neurological Emergency. I got this phrase from the book 30 Million Words, and I included the quote from here. And it says, the development of that brain, science shows us, is absolutely related to the language environment of the young child. This does not mean that the brain stops developing after 3 years, but it does emphasize those years as critical. In fact, the diagnosis of hearing loss in babies has often been called a neurological emergency, essentially because of the expected negative impact of the newborn's development. And so that's how I got the title of my presentation. And I wanted to watch this clip, and it shows how it compares a hearing child and a deaf child and how language deprivation can affect the deaf child. And we're just going to watch it to 1:32. And I believe there's sound. Perfect. So in the video, you can see the hearing child picking up vocabulary, but also language skills. The first example, the child was crying and the parent gave the child milk. And this helped the child to learn cause and effect, which is a language skill. So the child's learning is that when I do this, when I cry, this person, mom or dad, will do this. I cry, mom and dad say this word, they bring me food. Next time I'm going to cry just like this, so mom and dad will bring me food faster. The child is also developing self-awareness of what these feelings are and what is needed to do to address these feelings. However, the deaf child does not get the same exposure to language as the hearing child. The deaf child was crying when the parent trying to communicate to the deaf child. Eventually, the parent gets right. The child does not get the communication or language as the hearing child. And you also see in a different example when the parent told the child, "I love you." And this helped the hearing child to develop a strong relationship with the parent. And the hearing child also feels safe and loved. So feeling safe and secure helps us to have the confidence to explore and develop curiosity, which can also help us develop more language skills. The deaf child would have less access to positive verbal affection than the hearing child. Then you have the hearing child in the school situation. The hearing child was using language to predict and problem solve. The hearing child was also developing self-confidence and self-determination skills. The deaf child was missing the information that the teacher was trying to communicate to the deaf child. So this video is a great example of language deprivation. The main concern we have for deaf children is to make sure they have access to language. Next slide, please. So you may have noticed in the video that the brain was making several connections during the early years of the child's life. If you have a deaf child that does not have access to language, the child becomes deprived of language. So if the child is not able to access language with amplification, such as hearing aids, cochlear implants, meaning the brain just doesn't quite understand what it's getting, or if the child does not wear any amplification at all, or the child does not use sign language to communicate, the child's not getting access to language that the brain needs to make new connections. There is a window between the ages of 0 and 5 where it's absolutely critical for the brain to develop language. If the child does not have access during that critical period, that window shuts. Cognitive activities that depend on their strong first language will be underdeveloped. If you look at my second bullet on this slide, you can see that missing this critical period can result in never being completely fluent in language. That means there's not a plan B for deaf children if they're language deprived. And so we're unable to make a gamble and say, let's hope this one intervention works. And if it doesn't, then we'll go to plan B. Once the window is shut, the brain would be unable to make new connections. So this could look like where the child was deprived of language a little bit and now struggles to read above a 3rd grade level because of the comprehension skills that are required. Or it can look really severe where the child has 0 access to language and never become fluent in any language, such as sign language or spoken language. And the child is limited to pointing and gestures. And next slide, please. So now that we understand the vital importance of language for the brain, we need to know that what kind of language stimulates the brain and keeps this window open so the brain can keep learning. Research shows that regardless if it's sign language or spoken language, like English or Spanish, the brain can still process it. This is fantastic information because it gives us more tools in our toolbox when it comes to early intervention. So remember how I said there isn't a plan B for deaf children? We can't say, oh, we'll try this language first, and if it fails, then we'll try this language. We can't do that because language deprivation is so serious. But with this research, we can give the family several tools. We can give them a toolbox of tools to help their child access language and keep feeding the brain. And next slide, please. So now we're going to discuss amplification. So where does amplification fit in all of this? How do hearing aids and cochlear implants make a difference for the deaf child? Amplification can give the child access to language. Children can be successful with language development with their amplification. However, it's not as simple as we wish it could be. One can assume that if you put on an amplification, if you put on hearing aids or cochlear implants, you automatically hear. Just like if you put glasses on, you can see. But that's not the case. You can have 2 people with the exact same audiogram, but they hear differently. It's because we actually hear with our brains, not our ears. Our ears just bring the sound to our brain, and then our brain interprets the sound. So for some kids, they're going to hear great with their amplification. They're going to do fantastic with it, and they're going to pick up language and they do fantastic. Other kids are going to struggle because the brain hasn't made sense of these sounds that the ear is bringing to it. So just so you can understand some of what it might be like for a deaf person, I got my cochlear implant 2 years ago, and my situation will not be the same as a child, but it gives you some perspective from a deaf person. So I absolutely love my cochlear implant. It's helping me hear conversations that I wouldn't be able to access without it. When I first got my cochlear implant and they turned it on, for everything sounded like chimes, okay? Because my brain did not know what these new sounds meant. So a dog would sound like chimes, a car sounded like chimes, people sound like chimes, everything sounded like chimes. And I just didn't know what was going on. It's just chimes constantly around me. And then over time, I was using the tools that I knew from deaf education. I was able to help my brain understand what these sounds meant. And over time, they started to sound like a dog, a car, and a person. I'm still developing these skills. I mean, just the other day, I'm like, I think that's a bird I'm hearing. So there's still sounds that I am still learning, even though it's 2 years later. So overall, deaf children's language are below average by age 3 years. So it's important that we're using several tools in the toolbox to help the brain understand what these sounds mean. Can you go to the next slide, please? So this is talking about early intervention. Okay, early intervention can help children develop strong language skills. And the 2 quotes that I have in here, well, the 2 references that I have in here are about children that have early intervention are more likely to be ready for kindergarten and develop strong language skills. So we talked about the brain developing, how it's so critical to have language stimulating the brain. And then we also talked about how if the brain does not use language, it starts to shut that window so it can't learn these language skills. So I want to watch this video just till 2 minutes and 10 seconds. love the example of a plant. It's a great example to show how the brain needs access to language to thrive. Next slide, please. So this information is from the Joint Committee on Infant Hearing, and it describes best practice in early intervention for the deaf. So timely access, meaning they're referred early, culturally competent services, progress monitoring to 36 months of age. Families are active participants, and families have access to other families with deaf and hard of hearing children. Deaf, hard of hearing adults are active participants, and families have access to support from deaf and hard of hearing adults. And then we need providers that have specialized knowledge and skills. Those that teach ASL are native or fluent, and those that teach listening and spoken language are provided by professionals with specialized skills and knowledge. And deaf and hard of hearing children with additional disabilities have access to providers with specialized skills and knowledge as well. Next slide, please. So my point from this, my takeaway is I really like to emphasize that one size does not fit all. In the education field and special education field, we're constantly emphasizing on differentiating our lessons so children can learn. And sometimes in deaf ed, we're like looking for one solution. But deaf education isn't different from general ed or special ed. We need to be looking at all the tools in our toolbox and making sure the child is reaching language skills, language milestones. And so, if this tool doesn't work, okay, what can we add to this tool? Or what should we swap with this tool? Or how can we use this tool differently? We also need to have crucial conversations with parents when we start to see the child falling behind, or if the child has a few gaps in their language and the building blocks that they need for language. And then as a team, including the parents, we need to look at the toolbox and identify what's working, what's not working, and then what we can do to strengthen the weak areas. Next slide. So if you're interested, this is additional research, and it is actually through USDB, and it has so much more information on deaf and hard of hearing children and how they learn and best practice. And I would like to share that with you. Next slide. And 14 and 15 are my references, and that's all I have. Thank you for joining. I believe now is the opportunity to ask questions. And I have the interpreter pin, so if you raise your hand, please voice, because I'm not going to be able to see you.
So if anybody has any questions, feel free to go ahead and ask.
Yeah, this is Pat Boyle. I have recently been exposed to a bone, like the Baha.
Okay.
I don't know anything about it. So can you expand on it?
Yeah. Okay. So that a Baha is a type of hearing aid. And so this is for a child that typically has mid or out ear problem. Okay. And so the Baha, well, what works with the ear is that the sound goes in the ear, it goes through the eardrum, which vibrates. And then you have these smaller bones, which all vibrate. So they're all amplifying the sound by the time it gets to the inner ear. So what happens, the Baha actually kind of passes all that to send the vibration to the inner ear. And so that's a way to help the child hear if the mid and the outer ear don't have, if it has something missing or they're not working correctly.
I have a question too. I know that online you can get I think they're called auditory simulations that will show a family what speech sounds like to a hearing impaired child, unaided. Can you direct me to a specific source for that to find some really good ones?
I know a fantastic one. There's one where they had the Flintstones, but it doesn't quite show what a mild hearing loss would look like. And it's really helpful for parents to understand that a mild hearing level will, the child will miss some information. So I actually know one through an audiologist, and she has a couple of examples at different levels, and I can find that and send it to you. What would be the best way to do that? I'm curious to send it out to everyone.
Email?
Okay. Let me see. I have the interpreter pin, Karen Butler. Okay, I will. Can you put your email in the chat? And I will make sure I get it at the end.
You can probably send that to Early Echo, and then Janelle can post that on the Canvas site, I believe.
Okay. So Janelle, would that be better to email you then?
Yep, just email that to me and I will share it with everybody that attended today.
Okay.
And then we had a question in the chat. This is from Crystal, and it says, I recently spoke with a former PIP parent whose child was fitted with a BAHA, but now at 7 years old, would like to learn sign language. What would be a good resource for the family?
It depends on the state. And then, so I'm assuming this child's in Utah.
Yes.
Yeah. Okay. So
yes, I think so.
The Deaf Center is a great place to learn sign language because it's online and it's virtual. And let's see, this is Roots for Kids, right?
Root for Kids, yes.
Okay, so there's two deaf centers. One is in St. George and the other one in Salt Lake. So the one in St. George may have in-person sign language classes. And then if the child is receiving USDB services, the child could possibly receive a deaf mentor. Also going to community events, the deaf community events is a great way to learn sign language, and just being very open and saying, hey, I'm trying to learn sign language. I'm trying to introduce my kid to some other people to help learn. When we interact with others, it's easier to learn a new language other than trying to learn from a book or Duolingo, even though I try to use that myself for Spanish, but it's not consistent with me. So anyways, trying to interact with other people would be definitely the best way.
Can you kind of go through and explain the different technologies for hearing? Because I know, like, yeah, there's hearing aids and there's BAHAs and there's cochlear implants, and then there are children who are just deaf, profoundly deaf. Nothing will work for them. So can you kind of talk about that?
Right. Okay. So if the child roughly has a moderate to mild hearing level, hearing aids would probably be the greatest solution for the child. And this is something they need to discuss with their audiologist, because the audiologist would know a lot more about the child's hearing level. Hearing aids amplify the sound, they make it louder. How effective that is all depends on the child, because the brain is what hears it, but we definitely have to get the sound loud enough so the brain can actually get it. Then you have cochlear implants, where everything in the outer and mid ear work great, but the inner ear is not working great. That's actually me. Okay, in the inner ear, the cochlea, and you have hair cells in there. Okay, mine are damaged or missing or broken. I'm not sure what it is, but because they're broken and damaged, no matter how loud, well, I mean, eventually I'll be able to hear something and make it really loud. I'm pretty sure you can, but I'm profoundly deaf. So there's a point where the hearing aid is not going to help me. So I actually went to get new hearing aids 2 years ago. My audiologist said, "You're too deaf. You can't have hearing aids. It won't do you any good." So that's where I went to get a cochlear implant. And so in that cochlea, it looks like a snell. They put a little, looks like a little wire, kind of looks like that. They put it in there. So the sound hits my mic, sends it to that little wire in there, and that replaces the hair cells and sends that message to the brain. And so if a child has a mild level, you definitely would not do that. You just get hearing aids for the child. And so Baha is like a hearing aid, but it works on the outer ear. Now, beyond the cochlea, you have a nerve. And if that nerve is missing or damaged, no matter what you do, you will not get a sound to the brain. And so there's some kids just do not qualify for amplification at all, because no matter how loud you do this or what surgery you perform, the child cannot get sound to the brain.
There was another question, Stephanie, that says, if a family wants to exit prior to 36 months, do you have recommendations for other supports or referrals? And this came from Angel.
Okay, so yeah, that is a concern we have when families are like, we're not concerned, we're not going to continue services anymore. I really think it's important that the family knows how to monitor their child's language development so they can identify quickly if the child is starting to get some holes in their language. And then also for our program, we will call back every quarter just to see how things are doing. And sometimes families are like, yeah, there is a little bit of a problem, we want services again.
Okay, I'm going to give about 30 more seconds for questions.
We just had a family today whose child has been diagnosed with a unilateral hearing loss, and the family is having a hard time understanding why it's important to have services. Why isn't one ear good enough? Can you share some insight in that?
Yeah, so part of it is that the direction of where the sound is coming from. So if I can only hear on my left ear, and I hear you speaking from over here, that should be great. But if someone's over here and they're trying to speak to me, it's going to be more difficult for me to hear what they're trying to communicate. And for a little child, they learn with what interests them. They're not going to be saying, oh, well, this person's speaking, let me make sure and get a good angle to understand. If it's not relevant to them, they're just going to ignore it. And then if you also have background noise, then it could be a lot tougher to hear with that one ear. So those are just a few of the things where it can be a little rough with that. And then depending on how much the other ear can hear, we want to make sure we're using the amplification the best we can. And so it may require some practice and strategies in helping the parents understand how to use the amplification.
So I have a question for you. Hearing aid technology is advancing rapidly right now. What has happened with cochlear implants? What if there's somebody that's got a cochlear implant that was done, like 10 years ago? Can you describe kind of what's happening in that area in the field of that cochlear implants?
Yeah, we actually just had a spring workshop where we had the cochlear implant reps come share to us, and it was exciting for me to hear what they were doing. So I would say the biggest thing is how much they can preserve hearing. So it used to be that if you got a cochlear implant, it would destroy whatever hearing you have left. When I went to get mine, what my ENT told me personally, that I had a 50-50 chance of preserving the hearing. And we're hearing from a lot of people that they're preserving the hearing that they do have, which, I mean, honestly, it's kind of relief, because when you take it off, you can't hear anymore, right? So if you can preserve whatever hearing you have, if you have to take it off for numerous reasons, to sleep or whatever, so it does come off sometimes. So you don't want to lose all of the hearing. That was my biggest concern when I was going through the process. Another thing is a lot of them are waterproof up to a certain point. And this is really important, because when you have little children that get into the bath, and before you had to take off amplification, they did not have access to language in the bathtub. And there's so much, the child's right there in the bath, you have their attention, and that is just a great time for the child to be interacting with you in the language. So now I'm still nervous. I'm still nervous around water, just because of my experience. But the cochlear reps were like, yeah, put the kid in the bath. It's fine. Don't worry about it. They were not worried about it at all. And then that's also great if you're going to the beach or, splash pad, and you want your kid to have fun and not be like, oh, I can't communicate with my friends and family anymore, I have to take it off. So the water thing is a huge thing. They're also MRI friendly now, all 3 brands. So that was an issue before, and I believe it was last year or 2 years ago, all 3 of them are MRI friendly. You don't have to worry about getting them surgically removed. And then you also have some cochlear implants. You have the processor, or well, it depends. You have a part that goes on the back, and then a part goes on the ear. But now a lot of them are just off the ear, they're completely on the back. And some parents like this because it's not so easy for the kid to grab and take off and play with. So it's just in the back of the head, so the kid can't really grab it all the time. So that's just off the top of my head.
Great. Well, Stephanie, thank you so much. And be sure to use our discussion boards if you have any other questions. I am going to ask Jennifer Levitt. I probably cannot see you, Jennifer. Let's see, there you are. So Jennifer, you are who is presenting our case. Would you like to share your slides, or do you want me to share them for you?
You can go ahead and share.
Okay.
Let me get into them.
And then can I also just do a reminder to the interpreters to write interpreter next to it. So I put you in the right breakout room that Stephanie is going to. All right, Jennifer.
Okay. I guess I'm new to this. I don't know exactly what you're wanting with this.
Just share your case with us and what
Okay.
you want us to discuss in those breakout rooms.
Okay, I have a little, she's a 33-month-old little girl, and she was born, thank you. Microcephaly, missing her frontal lobe, cerebral palsy, G-tube, lots of cognitive and motor disabilities. She doesn't really respond to sound. She doesn't have any visual responses, and she has severe scoliosis. So basically, I started serving her when she was just newborn, probably like 3 or 4 months old. And then about at 6 months, mom stopped having any services. She just kind of cried all the time. They didn't know what to do with her. And I think she was more annoyed with early intervention services coming in and telling her to do stuff with her child that just cried all the time. So she started taking her into some outpatient physical therapy probably a year ago. And he's told her she needed to get back in with early intervention. And so I've just barely started seeing her again at 33 months, so she hasn't had a lot of early intervention. Mom's great. She's really young. Didn't know she was pregnant when she had her. Just like right before she graduated high school, she had the baby, and has a 2-year-old little boy that's very, very active, and she lives with her parents. So basically, we've tried a lot of things. We've talked about communication with her. We're just kind of getting ready to transition her to preschool, and I'm just wondering ideas that anybody has out there for her. She doesn't have any kind of spastic movement. She just really lays still. I can put some Mylar under her feet, and sometimes she'll move her legs a little bit. We do a lot of textures with her. Mom's really good. Take her swimming. She doesn't really, sometimes she shows some responses when mom says her name with a really high-pitched voice. She kind of gets a little smile, maybe. We're saying it's that because it's pretty consistent when she makes that sound. And I guess that's about it. Mom's really good at reading her cues. She doesn't have a lot of complaints. She never cries anymore. So I guess just if anyone has any ideas of things that would help me with transition and doing some things with her in the preschool classroom. We just talked a little bit about using a little room. Could be effective with her, maybe not. She doesn't move very much, so I'm not sure. And then she's also getting her hearing tested next week. We've been pushing, hopefully we can get an intervener for her, but mom feels like the hearing is okay, so she hasn't done much with that yet. So anyways, that's about her.
Okay, if anybody, before we move to our breakout rooms, wants to ask Jennifer any last questions about the case, we'll just take a minute to do that.
Will you put up the summary of the child again, just because there was a lot?
Yep. Let me just share my screen one more time.
I probably said more than what I wrote down.
Oh, okay. What things have you already tried with her?
Just like I said, a lot of tactile stimulation. We haven't done a ton. Most of our visits were Zoom until just this last month. So mostly just talking to mom, giving her ideas. We talked a lot about touch cues with mom. That's pretty much it so far. I just haven't been in there very long.
Oh, you've tried tactile. Have you tried anything with audio, music, or anything like that? Does she react and respond to that?
We have a little bit, and I've asked mom a lot about that, and she sometimes startles when she's not expecting a sound, but other than that, she doesn't really show a response to music or anything like that.
Jennifer, hi, it's Lisa. How are you?
Good.
Hey, why does mom think she's hearing fine? I'm just curious as to what mom's thinking is on that, because it sounds like maybe she's not hearing.
Mom thinks it's more of a cognitive processing. She probably hears, but doesn't process what she hears. So that's where she's at, and she startles to loud noises. Like if the brother runs in and screams or something, she startles at times, but she's pretty used to it. So it's inconsistent responses.
Does mom have any other support? Like, is she part of like a parent group or anything like that with kids like her own?
I don't think so. She's going to nursing school. And just her parents, and I think she has a boyfriend. But I don't think she has any friends or outside people within her similar situation. So that would be that'd be good for her. She may follow a few Facebook groups.
Okay, so I'm going to go ahead and open up all the breakout rooms. We're going to go in and just talk about it. And then we'll come back and do some final wrap-ups.
How long in the breakout room, do you know?
I don't know. About, let's do 15 to 20 minutes.
Thanks.
Did you call Jennifer Peterson? I did. You did? She's on the line. Thank you. Yep.
Do you want to make me the host, Janelle, so that you can join the breakout room?
Yeah, just 1 second. Okay, Rachel, are you?
Which one do you want to be in?
Oh, I don't care. Am I the last one here? Or go ahead
No,
and make
there's
it.
some that haven't joined yet.
Okay, let's go
So
ahead.
if you just hit that accept or join breakout room on your screen if you haven't yet. I'll put you in 3.
Is she in a movable chair, or is she, you know, does somebody have to do that for her? And then what would be provided at school for her, you know, if she is immobile or needs?
Right. Well, you know, those obviously are questions that, you know,
Yeah.
weren't answered, but
So-
being a physical therapist heading towards your 3rd year, if she's involved in any kind of therapy, then that would be the onus. I would have put her into something by now. But I think the biggest piece is, how does she communicate? You know, how does mom know what she wants? You know, how does she know and she has a G tube. I think she said she had a G tube.
Yeah, sit down.
So that, you know, hunger, which is your most basic sort of communication point, is already being answered. So I know there's alternative forms of tactile communication. I don't know what everybody's experience with that is. There's a really old technique that we used to use where we would do something with the child. They'd raise a hand and we'd say, okay, you're communicating, and we'd repeat the process. Does anybody remember what it's called? We did it like 40 years ago. But it's with your child who's severely multiply involved, where you're taking like an eye twitch as a form of communication and building on it. So I don't know if that's, what's it called? Anyway, it's a, do you remember? It's an alternative form of communication with the severely multiply involved. Oh, well, Anyway, that's it. Anybody else have anything to offer?
No, I think it'll be good, when she finds out about her hearing, whether or not she's got some, any hearing impaired, to help with communication skills or how to go about that. I kind of wondered on the startled thing, did she say that she also was visually impaired? So maybe she's more startled by seeing a quick shadow or something than she is by noise.
Mm-hmm.
So I'd be curious to see, like I said, I know we don't know, but what the school provides, what kind of preschool this is that she's entering, and what kind of things they offer at the school that are going to help her to communicate and, be able to say her wants and needs. And
Well, I know, yeah, you're from Butte. Here in Utah, it's the need that is most, so if her vision and hearing aren't her most pressing need, she will go to a preschool program in the school district. So Shreese is here. You can tell us.
Where she would go in school?
Yeah.
Oh, I can't tell you that, Pat. But the parent would have the option whether they would want to go to the school for the deaf and blind, or if they would rather go to the different preschool. They get to choose between which schools they want to go to. I do know that. But if she is having hearing and visual impairments, then I would assume the best place for her to be would be the school for the deaf and blind, so that she has those professionals reaching out for her. This is one of the hardest cases probably to work with when you're in the home, because it's really hard to see the progress that the child's making. So you would want to have some sort of thing like Pat was talking about, for them to be able to communicate by blinking their eyes or by reaching or touching something. I would probably want to work on that with them, because communication is so important and valuable. Yeah.
Do you guys have available in Utah, is there any PTs and STs that go into the home?
Mm-hmm.
Or you do? We only have one here in our area that does that, so we're very limited over here and where I'm from. So I was just curious, because that helps teach the parents, or the family members and caregivers, in the home. Then they can learn so much more to how to communicate and how to help her communicate. I was just wondering, like, how much education and help mom could have and grandparents.
Well, until COVID, we were all going into the homes.
Oh, nice. That's nice.
Yeah.
We go into the homes for my job, but we don't for our speech therapists and PTs and OTs. We don't have that luxury to have them going into the homes.
Hmm. Well, one of my therapy inputs with this little girl would be, so I would work on her vestibular system, which movement system. Does she like to be bounced? Does she like to have does she like to be put her in a blanket and, that sort of thing? And then I would then go in and just say, did she raise an eyebrow? Did she laugh? Did she do something? And then reinforce that over and over. So again, where's Angela? I'm going to pick on you, Angela. What would you do?
Yeah, I was thinking the exact same thing. So putting her in a blanket and trying to swing her, putting her on top of a yoga ball and just kind of like holding onto her hips and kind of moving her side to side on her tummy. Even taking her, like putting her on a blanket and kind of dragging the blanket around the room or something like that. Like just something to get her kind of moving, seeing if she likes any particular like motion of movement, or if she likes turning over, or and I don't think that we got any kind of summary from the person who presented on her about any kind of movement. So that was where my mind jumped to as well.
Is that a consensus?
Yes.
Okay.
I know that we have families that are from the polygamous community, and we get a lot that are really severely delayed. And so our physical therapist that works with those children really works with the parents to bring opportunities to the child when they're not mobile. So introducing them to different items, like even I've heard her get like a paint roller and just things that kids would naturally come across if they were exploring, but bring the exploration to them because they're not mobile.
Okay.
Does she have any, it would be interesting to know if she has any neck control too, to be able to sit up, because that kind of limits stuff too if she's in a laying down position all of the time, of where her exploration can go. And what exactly is missing if your frontal lobe is gone? And what that seems.
Sorry, well, it's your executive function. It's the processing. It's your executive function. But you know, you can say something like that, but the biggest thing I've always said is function over form. So they've done an MRI and said she's in the frontal lobe, but I think we need to look at what is her functioning. And so not to say she
And
can't
her,
do anything.
well, and her brain would obviously, we've seen miracles happen with brains, that if a part of it is missing, another part takes over. So it's not to say that something is not going to happen, but I think you would want to work on neck control and trunk control first, right? To get her into a position that she could sit up and play and hold things. And so maybe even just a sitting device to get her into that upright position.
Yeah, and I think that's what Lori was talking about. Is she in a wheelchair?
Oh yeah, true.
Yeah, and did they mean by CP, were they saying cerebral palsy? I seen that in the write-up that the presenter had said, and with the G-tube and stuff. I wondered if CP, if they were referring to cerebral palsy that she also has.
Yeah. So have we heard from everybody? We haven't heard from Dawn.
Yep. Hi, this is Donnie. Can you guys hear me?
Yes.
Okay. I'm still kind of new to this, so I guess the only thing for me, I thought maybe some massage, depending on approval from, you know, the doctor on where you can, what areas you need to make sure you stay away from. But I think massage probably would be good.
Absolutely. And then Jackie, you're a family support specialist. With whom?
Highline Home Programs in northeastern Montana.
Okay, so what do you do? Are you like the service coordinator?
Something like that. We go into the homes and we work with activities and things like that for different outcomes that the family wants to work on. We also get them connected with services that they need to be connected with.
Okay, so do you have any sort of input?
Not this time. I don't have any kids with these particular things.
Okay.
I've learned a lot from what you guys have said.
I mean, she's doing those tactile things, but books with the different tactiles. And if her vision is there, she could maybe recognize maybe different colors or respond that way too. Maybe she has a preference in color that she likes that she could touch or respond to. You have to definitely be creative with this situation for sure.
Well, and I think it's telling that mom wanted to bag it, you know.
Yeah.
She was done with EI and saw no changes, and you know, but if there's a brain, if there's eyes, and if there's ears, you stimulate it.
Yeah, and I guess that's kind of my question too. I know that the caseworker said that mom's really engaged about swimming and stuff, but at the beginning to say that she took the child out of EI and that she is such a young mom, it kind of makes me wonder how engaged actually mom is and open to, in her case, many therapies and different ideas and alternative, you know, ways to do things, you know, because I think with mom and grandparents, you know, and I've had that in other situations with not a child with so many disabilities, but sometimes there's a lot of conflict where grandparents, if with the younger child that had a child, grandparents have a lot more say, or they might agree and disagree. And so I would really be kind of curious on the family dynamic also to make sure that we have those right people in, you know, buying into it and wanting to do what needs to be done to help her be successful.
Janelle, do you have anything?
No, I've just listening to it. Like Jackie said, I don't know that I have a lot of experience with children that have those multiple things, but I do wonder, I loved the idea of that, just that motion of movement, the swinging in the blanket, those different type of ideas. Is there, I was just wondering if there was like a resource or something to figure out simple games like that. Angela, do you know, is there a resource that other providers could locate to find those information of simple games?
To be honest, no. A lot of like my ideas are have come either with experience or seeing other people, other therapists work with kids, or even just looking at like like little activities of how you can stimulate the brains of even infants that's safe, because I mean any of that could potentially apply. And so not particular resources. I'm so sorry, I apologize for that. I mean I could come up with several ideas, but not that I could go to like send other providers to one particular location and find those same things. I'm not sure. Not that I know of.
Okay.
Well, I think it's important to look at the sensory system, and that's what your massage, that's what your movements, that's what, enhanced sound. And so that's where babies are, it's their sensory system. And if you look into any of that kind of research and pair it with a child with special needs, that might help.
I was going to kind of say, like, looking at, I work with a lot of children that have autism, and, a lot of the stuff that, like textures and sensory, and, so there might be a lot of stuff that she could look into in the autism world of different things, like wrapping in the blankets and the sensory sacks, or, like you're talking about the, movement. And so I would, as somebody that's kind of looking for something, you could probably look in the autism, sections of stuff and find some stuff that you could work with her with when it comes to sensory and tactile and some communications.
Yeah, I know that one time I had an OT that I worked with. He always recommended Raising a Sensory Smart Child. That's, and Pat, you're smiling. Do you know that book?
Well, Angela and I are sensory people.
I know. And I just was wondering if there were ideas like that in that book that would help the providers that work with this family, as well as the parents at all. Do either one of you guys know that?
Well, I think the one thing to be cautious about is that you can quickly overwhelm a child with sensory input. So I think that's why you pair with, say, a therapist that would understand when the child, because you can look at things like the child can go gray or can go white with, they can lose their color. They can start hiccuping. I mean, if you go back to the sensory development of the infant, and especially and of course my background is preterm infants, but it's looking at the subtle sort of, you want to look at their physiology, you want to look at how they respond to that input, because it can be very dangerous, sensory input.
So I wonder if another really good suggestion might be because Jennifer, who presented, is from the Utah School and the Deaf and Blind of Vision Support, recommending that she do some co-visits with an occupational therapist from the early intervention program, or something like that. We're going to be going back to these main rooms. So I don't know, Barbara, Pat, if you want to recruit one of us to give a little wrap up about our breakout rooms, or if you want to do it yourself.
Well, I've written it all out.
Okay, then you're going to be the one who does that.
One last quick thought is, thinking of Stephanie's presentation with the language deprivation I wonder if there are things that could be built on to help this child not suffer so much from such a language deprivation. I don't know what the answer is, but.
No.
Hi, do we have everybody back, Rachel?
Yeah, we do.
Okay, so we're gonna just take the next 10 minutes. I'm gonna have I hope each of your breakout rooms nominated somebody to speak. I'm gonna start with group 1. I know Kurt just is shaking his head. Well, I'm gonna give you just a few seconds, Kurt, I'll cut you off.
Okay, sorry. I was telling you no because I'd lost the thing and I couldn't get myself unmuted. So we had some questions with regard to just the hearing. We talked a lot about the ability to process sound and what kind of communication we might be able to get. It sounded like the child was largely visually impaired to where vision wouldn't be something that we could utilize for that. We talked about in transition, helping with transition, just making sure that we have that intervener, the specialist, come with the child to the IEP transition meeting, looking at any things that have been tried previously with regard to assistive technology or something like that that had been tried and either had been successful or had failed. Talked about a lot in both the general as well as the help with transition about the importance of touch and bonding with regard to the mother and child or an intervener or a teacher and a child. And then the comment was made in the general part of the echo today about a little room. We thought that would be a good idea to kind of concentrate that sound around there. If there's some hearing impairment, but at least I would concentrate the sound and help with some of the communication and other interaction type stuff. I think that's pretty much it.
Thank you. Great ideas. Her hearing is unknown at the time. I think it's more of a, mom thinks it's more of a processing kind of thing. Anyways.
Kate, what about your group?
Yeah, we talked also about the tactile supports and resources, and specifically we talked about the idea of like a visual schedule but a tactile schedule, so using like a diaper and wipes to help her know that diaper changes are coming, or a toothbrush that, you know, let her touch the toothbrush to know that the toothbrush is coming, a spoon before eating, a little car to know that we're getting in the car seat and going on a car ride, you know, utilizing that tactile component. Also, since we don't know about hearing, we wondered about just kind of using short phrases, short consistent phrases to prep her before certain activities. And somebody had said Daniel Tiger has a bunch of different fun examples that you can use, but you know, maybe they have a little diaper changing jingle that they sing before they change her diaper so that she knows and she consistently hears that phrase to help prepare her to know what's coming. And then we talked about connecting with the Utah Parent Center group, and then there was another resource for respite care that I wasn't familiar with, but I know Tara, did you write it down by chance what it was called? Thank you.
I just got that it was DSPD.
DSPD. Okay, I see people nodding their heads, so it looks like.
So that's the Division of Services for People with Disabilities.
Oh, okay.
And each state has a division to support that.
Okay, great.
Good, great. Anything else, Kate, from your guys' group?
I think that about sums it up. If anyone else has anything, feel free.
The only other thing we had was just positioning and, you know, making sure that she was in a position to, and, you know, I'm a physical therapist by background. And so, and have worked for an extended amount of time with kids just like this, and making sure that they had good positioning and supportive positioning. It just helps to be able to use the vision and the hearing that they have.
Do you have recommendations on something other than her wheelchair for positioning in a classroom, or do you know, what's the best? I mean, if her wheelchair keeps her in the best position.
Yep, the wheelchair. And there's some floor sitter kind of things, but even, you know, being able to be supported by somebody out of her chair, like, you know, sitting, just to get the different, you know,
throughout the day,
different movements and different, you know, things throughout the day.
Standing frames can also be very good for positioning children and optimizing vision and hearing as well.
What about a beanbag chair? A big beanbag chair just for relaxation, out of the wheelchair, but not in bed. So she's supported, but she's in a comfortable position.
That's how she is positioned at home most of the day. So I don't know, we could talk about that in the classroom.
Yeah, and you know, that is a good option for the relaxation part of it, but the engaging and the, you know, using her vision, and so, you know, her vision and hearing, that's not going to be a great option, but, you know, having those scheduled times throughout the day, and that was kind of part of the tactile schedule, but having those things scheduled throughout the day.
I would also check with the doctors, because I think it was mentioned that she has pretty severe scoliosis, and there might be some positions that aren't going to be recommended due to that.
Kirsten, how about any from your group?
So we had some of the same things that people have talked about. One of the things we just said right off the bat, that even though the mother thinks it's just processing, it is really essential to get that hearing test. So we're glad that's scheduled. The idea of the EI providers communicating with the PT that already has that relationship with the family, so that you can learn a little bit more about the past, what's been done and what's worked and what hasn't worked, and what that professional's opinions are. And then we talked about a lot of that tactile and multisensory input. And I really liked Karen talked about just wanting to know how this child shows joy and how do you elicit joy, and turning that into an interaction, a social interaction with the child, so that you can get some turn taking going there. And really just trying to emphasize any type of social interaction that you can. And so, you know, including like the massage or any of that tactile stuff. And then we talked about also for the mother just having support systems and some self-care for her, because it sounds like she is spread a little bit thin. So.
Great. Summer, were you in a different group?
I was in the group with Kristen.
Okay. Pat, what about your group? So Pat, you're on mute.
Okay, sorry about that. We talked about a lot of the things that have already been mentioned. The biggest thing that was brought up first was, what kind of position is she in? Does she have a wheelchair? Does she have something where you can work on getting her head aligned and her trunk aligned so that she can be more engaged and interactive? And then we talked about her sensory system and using sensory input as a communication device. So Angela, one of the OTs, mentioned using just a lot of vestibular, putting her in a blanket and swinging her, sitting her on a ball and bouncing her, and seeing whether or not you can get more reciprocal engagement. Maybe she smiles, she laughs, she does something, and then reinforce that as a communication, because the biggest piece is that she is language deprived, which was mentioned in the talk. Talked about using massage and bringing opportunities to her rather than expecting her to obviously engage. So yeah, other than that, it was all sort of the same thing.
Great. Barb, how about your guys' group?
Actually, we were in with Jennifer, so she already knows all what we told her.
How about for the rest of us?
And I'm not, I would say we probably had a lot of the same things. We got to benefit from Jennifer being in there, and she did tell us, so just going back to what Pat just mentioned, that there was I think Jennifer said that she was, the PT had swung her, and she laughed and smiled about that. But then since then, mom tried it and she hasn't. But we talked a lot about similar kinds of things, about getting that communication going, and also having mom make note of the communication so she can pass that along, what her cues are to the school, since she'll be going there soon. And then they also mentioned about her in the water and different PT kinds of stimulation for her. So it's real similar to what I think everyone else has brought up.
Okay, whose group am I forgetting? Who is? Okay, all of your groups, Jennifer, just so you're aware, we will be compiling all the resources. They will go on our Canvas site, as well as we will email those all to you. So you didn't have to just jot down everything or try to remember all that was shared with you today. So our next session is going to be June 2nd. Dr. Larry Edelman will be having a conversation with us about using virtual technology in the EI world. So we hope that you will join us. I'll be sending out invitations. Once again, just remember to complete those surveys, and you'll get your certificate of attendance. Unless anybody has any other questions, we will wrap up. Thank you, everybody. Have a great rest of your day.
Thank you.